Good morning, everyone, and warm welcome to the Sunday special with psychiatry teachers. The program Sunday Special with Psychiatry Teachers started 1 year ago, with a joint and a combined effort of Indian Psychiatry Society Faculty Training Task Force, Indian Psychiatry Society PG Education Subcommittee, Indian Psychiatry Society UG Education Subcommittee together thought that there should be a platform for the psychiatry teachers to come forth and discuss various components of teaching learning which has relevance for the undergraduate and postgraduate psychiatry training in India. The platform considered that when postgraduate teachers, undergraduates, and postgraduate representative come together in a single platform, there will be an opportunity for to listen from the experiences, learn from the perspective, and then take it forward. So, in this program, usually there are no chairpersons, there are no co-chairpersons, and there are usually no moderators. It is just to facilitate the discussion among the psychiatry teachers, and all the programs are video recorded and available in the YouTube channel under the same name, Indian Teachers of Psychiatry. Anybody can access these things at any given point of time. And in this program, the first speaker is usually a senior person who is a professor or associate professor. The second speaker is an assistant professor or a senior resident. And there will be one undergraduate or a postgraduate who speaks about psychiatry. So today we have Dr. Henal Shah, who is the additional professor at Topiwala National Medical College at Mumbai, and she is also co-director of the FAMER. She is the chairperson of Indian Psychiatry Society PG Education Subcommittee. She has been extensively trained in medical education, and we also know currently also Madam is undergoing training for CBME. So, for her keen interest in psychiatry education, her interest in other areas are in child psychiatry, where she is well known. And in this program, a rarely discussed topic about psychiatry postgraduate examiners. Do these examiners who conduct examination, what are their perspectives, what is the necessary requirements they should have, how should they look into it? There has hardly been any discussion. What challenges do they face, what kind of issues are there in terms of psychiatry postgraduate examination? Dr. Henal Shah last year conducted one of the biggest mock examinations for psychiatry postgraduates. For each session, there were more than 500 postgraduate students across India. For 2 days to 3 days, the program was held, and it was the most extensive program any time for helping the psychiatry postgraduates as well as the examiners to get tuned to the examination process. With this, I welcome Dr. Henal Shah. Madam, over to you.
Thank you for that very generous welcome. And I do congratulate this platform that it has managed to sustain over time and has got some relevance into psychiatry teaching and understanding of it and given a platform for people to talk and converse. With that, I'm going back to talk about really perspective for psychiatry PG examiners. And I'm just sharing a few slides, a few thoughts, and it will be open really for discussion. So, we always know why we examine, whether it is for help the student or to, have a few seats and give them and grade them, give them a certificate, understand the learning process, evaluate the program, all those multiple reasons why we assess. And we all know that assessment drives learning. And assessment can be of three types: assessment of learning.
Ma'am, you can put it on full screen.
Sorry, apologies. Assessment of learning, assessment for learning, and assessment as learning. So, assessment for learning is actually the most important for us, but today is more about exams and things like that. But not to forget that we have to really think as teachers, that how do we continuously assess our students along the 3 or 2 years that they are. We should have some kind of a program or a blueprint in our mind, and there should be the tools that we use should assess to assess the student to match with the purpose. And remember, no tool is good. I mean, no tool is perfect. There is no gold standard. Every tool has its assets and problems. So always use multiple teachers, multiple examiners. And the most important thing about this kind of assessment is that the role of feedback. Uh, and feedback has to be specific. It can be something which they can use and which can use it and do something about it. So it is very important to think about feedback and how we give it, and we empower ourselves to know how to give feedback. Moving ahead from there is thinking about summative exams. Exams are around the corner. Most universities will be starting exams. So if you could just have a little look at that and maybe talk about that. So in every exams that we conduct for PGs, there is theories and practicals, and of course there's a thesis. I'm just taking the example of my university, which is Maharashtra University of Health Sciences. They have 4 papers, LAQs and SAQs, long case, short case, and viva. The paper setter and examiners are different in the theory exam. So they've at least kind of separated that so that every examiner, every student is examined by theory, at least 2 or 3 people minimum, and by for his practicals by 4 people. So already we've got 6, 7, 8 people who are examining the person. So that's one good thing that has happened. And number of examiners for the practicals, we have 4. And it is important to use all 4 effectively. So as I said, in theory, we have long and short answer question. Long answer questions is not really the best way to go, but it's better to go for short answer questions. And how do you write short answer questions which were useful? So it's very good if we could use some clinical context. It gives better understanding. It gives you a better assessment technique for whether the person can really understand and use and apply the information they have. So it is at a higher level of assessment rather than just knows. And so the questions that come with that clinical context has been directly related, and that exchange cannot be answered without the case, So there's no point giving a case and then asking a question which is a recall question. You have to specify the number of responses, specify the mark assigned to each question, and incorporate some basic science principles. For us, it could be neuroanatomy, neurophysiology, psychology. So if you could use some of that also to kind of make the understanding much better. So if you're asking, say, about cognitive deficits in schizophrenia, and the case is that, and then you would try and understand something about cognition and schizophrenia, or cognition alone, maybe something about anatomy. So in different parts of it, you will try and get some questions that would answer that. Now, we also have MCQs sometimes, especially for the undergrads. We have 10 MCQs in their papers. So not necessarily with psychiatry, but even when we do get them. So there is a whole science on how MCQs are formed. But a very rough way of looking at it is, just to have a quick check whether the MCQs are good, bad, and whether you should retain it. So this cannot be done as an individual. It's good to have a team. It's good to have more than 2 or 3 people look at it. And of course, there is many other factors which I won't get into because it's very technical, but at least some thought going into what is being asked and why is it being asked. An important thing to remember is, something called a standard setting. How do we decide who passes and who fails? So there's 2 ways of looking at it. One is we say, oh, okay, the first 20 in the list will pass. So 20% of the population will pass, which is great in some places where we're saying that we have only 20 seats, so let's take the first 20. But if you really want to understand if the people know things and they can use it later, we should go for criteria referenced standard setting. That is, we have a criteria that they should know this much. And only if they know this much or are competent in this much will we allow them to pass. So this is a better way to go, and that is how CBME says you should do it. Okay, so if that is the way it is, how should we format our papers or practicals? Use a blueprint, and I'll talk a little bit more about blueprint. Focus on the important. We love esoteric, some syndromes which are really great, but really when the student goes out, your idea is, will he be able or she be able to treat common mental disorders adequately? That's the first thing you're trying to see. So please ask for core competencies. Those are the things that they must know. I mean, they may or may not see esoteric stuff, and even if they don't, they can refer it to someone. But they have to treat the most important things that come in psychiatric practice when they are out. So if you want to assess that, sample widely. Why? Because we take just one long answer or one long case, it is not necessarily that what you understand about the student can be generalized. He may be able to answer very well on schizophrenia, but he does not mean he can manage bipolar or substance use or something else. Therefore, sample widely across various things, various disorders, various levels of understanding and competencies. Uh, and as we always say, knowledge, skills, and behavior. Um, Try and use as genuine way of assessing, that is what they were likely to do, and what is really called as workplace based assessment. And slowly as systems are moving to that, NMC has talked about CBME. So I'm sure each of our universities will slowly go towards workplace based assessment and introduce more of it. Make as many instruments as possible is good, and vary your level of difficulty of questions so that you can grade the students also along the continuum. Suppose you had to do a practical exam, so how would you do a blueprint? So suppose the exam was for 35 marks. Then you would decide, okay, what is the pattern I have? I have Viva, short cases, and MCQs. Now, how many questions would I give in each, and how many marks would I give in each? So this is your first aspect of how you would blueprint. Next, then you have to decide, how do I go into what to assess and how many marks to give it. So this is an example of a blueprint. So you've kind of put the topics down. You've thought of what is the impact, means how important is this topic? Is it a very essential topic without which, they'll never be able to treat what it is? So you have to decide on the impact of that. You have to see how often does it occur in the population. Based on that, you come to this calculation. Based on that, you come to the weightage that is there for that topic. Based on that weightage of the topic, you can then give how many marks or how many questions you will give them. And based on that, how many marks will be given. There are now even blueprint sheets. A friend of mine and a colleague who I sometimes take blueprinting with, he has actually developed an Excel sheet with, you just enter your things and it will show how many marks. So there are ways of doing this, and technical things to do. But even when you don't do the technical, at least to think, what are the topics I should assess on? How frequent are that? So what should I ask for? How should I distribute the marks, and how should I distribute the questions? So this kind of at least systemic thinking should come into the picture. And then that led to, after they did that first two steps, it led to a practical exam where they had MCQs, and these were the questions of the MCQs. These were the short cases, vivas, and total marks. And this is directly proportional to the importance of that topic and the frequency which it occurs. So this makes it important, this makes it a very valid tool to kind of valid way of figuring out what to ask in an exam. And this blueprinting can be done whether it's a theory, practical, whichever exam it is. So this is a way to really think about it. What about long case? Like I said, problem with any of our medical topics is it's highly contextual. If I can answer this case of schizophrenia answers well, doesn't mean I can do others, and doesn't mean I can do other topics. And therefore, the reliability and validity of these exams are not very high, especially if you have a single case. You need many more cases and a very long exam to really assess valid and reliability. So what are the ways? Now we may not be able to change the system. So what can we do as examiners to make it more valid and more reliable than it is today? Remember, nothing changes overnight. Small steps which will help us to make it a better exam, a fairer exam. So use multiple sampling strategies. So like I said, in psychiatry, we in our institute and in Maharashtra, they get 4 cases. One is a neurology case, one is a long case, and then the other 2 short cases. So we try and see that these 3 cases that they get, that one long case and 2 short cases, are of different disorders. So we normally pull a chit, and in that chit we have clubbed cases. And the way we club them is that the long case and the 2 short cases are very different. So we have a wider range of competencies we are assessing. So whether you have tricks or you assign or whatever system you follow, see to it that you don't have schizophrenia as short case and a long case, because that's really not fair to the student, because you're not really assessing wide. All right. Second thing, also don't, very often, because we are running short, we'll say, okay, 2 examiners will assess this, 2 examiners will assess that other student, and we'll do it parallel. The idea of 4 examiners is to have multiple examiners to get better reliability and validity. So try not to split yourself into smaller groups. Keep those 4 examiners, because it will really, really help. Another way is of structuring that exam. So there is something called as OSLR, which is Objective Structure Long Examination Record. I'm just showing it to you. This is there for MBBS, but the same way. So like you have thought about how many marks for what. So how much for the presentation, how much for us physical examination may not be so important, but the mental status examination, for the investigations, for the management, for the clinical acumen. So you can really figure out and think about how many questions, how would you grade it? And in fact, they have also given ways of grading it. For example, they have, if it's a standard case, single problem, depending on the severity of the case, and then also whether this should be pass, borderline, and things like that. Even if you don't do an OSLR, the idea is if you can have a uniform way of going across the case, which the 4 examiners have discussed, and then follow it for all the students who are being assessed. So there is a structure, so that somebody is not asked about only one thing for a long time, others ask for a second thing for a long time, and then you can't compare. So try to get some structure in it. What about the Viva? Of course, there are limitations of the Viva. There is high inter-rater variability, inconsistency in marking. One examiner may ask a lot about some esoteric stuff. There is no standardization of questions. And very often they tend to be, recall questions and not so much of application and synthesis questions. So there is an issue with it. It has an advantage that you can have face-to-face and check on whether they can have understood it thoroughly. They've reported, you take about 12 to 16 case histories in oral examination to get 0.8 generalizability. And 0.8 is usually what we tend to look for. Reported reliability of oral examination in 4 hours is 0.5. So really, we have to be careful when we are using oral examinations. And it is important to realize that to have one examiner asking lots of questions is not good. It is better to have more examiners asking fewer questions. So each will ask four questions, and yet there'll be 16 questions rather than one person asking for 20 questions. So if you're an examiner, don't stay quiet. Please ask your questions. It's very important not to defer it to the senior examiner and let him take the exam. It's important that everybody asks questions and ask varying levels of difficulty. Start with the simpler, go to the more difficult answers, ask questions more on application, and if they don't know, move ahead. Again, for the oral exams, to improve the reliability and validity and make it fair, structure it, use a content blueprint, at least assign, okay, one examiner is going to do the topics on this, second on the second part, third on this, and fourth on that. Ensure and discuss with the examiners that they have varying level of difficulties. They have some standard of questions, and Try and use independent and multiple raters. In our system, we have 4 raters. Multiple sessions is not always possible, but in the long run, maybe it will come. And the last part that is really there is, after you finish the exam, people are worried. Should we fail the student or not? And we're really worried about it. Just like exam, students are worried, will I pass or not? Examiners are worried about failing students. And we don't want to be the bad person. But we really have to be sure that that student has passed the criteria of being able to independently manage common cases. And we have to be true to that when we are an examiner, whether we like it or not. Sometimes it can be very boring and sometimes very, very taxing, but that's the way it is if you're an examiner. So these were a few tips which I wanted to discuss, and with that I end my talk. Thank you.
Thank you so much, madam, for the lucid presentation. I think it is going to facilitate a lot of discussion, and all discussions we will encourage after the all speakers conclude their talk. So, from the perspective of the examiners, we will right away move to psychiatry postgraduates' perspective on what it means to be in the final year exam mode, and more importantly, what it means to be looking at the training which has undergone. To talk about it, we have with us Dr. Anusha from JSS Medical College, who is going to take up her exams in few days. Over to you, Dr. Anusha.
Thank you, sir. Firstly, I would like to thank Kishore sir for the opportunity, and I would like to thank all the teachers in this platform for choosing teaching along with your practices. I really admire teachers, and like especially teaching the postgraduates is I feel it is a tedious task. So I would like to share some of my experiences which have helped me during which have helped me throughout the course. So I'm Dr. Anusha, doing my second year DPM, taking my exams in the May from JSS Medical College. So,
Anusha, you can put it in full screen.
yes, sir. So I think to start with, for any candidate entering a postgraduate course, I think everyone have their own coming to the post graduation, entering it only every candidate have their own interests and some capabilities which need to be interviewed in the beginning, so that helps to encourage the candidate in particular fields. And also, I think research is one thing which we are introduced during our post-graduation times, and very few of us are exposed to that during our UG times. So encouraging candidate in towards research is also useful. And yeah, it helps us to gain new data apart from the existing data. So I think research is something which postgraduates are to be encouraged into. And yeah, assignments. So throughout my course, I feel giving assignments to the candidate and giving them sufficient time to pursue those assignments is important. So after a discussion on a particular case, if suppose a case has been discussed today, so extending on that, giving assignments to different candidates participating in the discussion, and getting the assignments back onto a common platform is really helpful throughout the course, and it is very much helpful at the end of the course also. It will have we'll have all the data related to a particular topic at a common source which we can have a quick look through. And also it helps in going to different sources in search of the particular topic, and also enables the candidate to compile the information which we read from different sources to a much consolidated form, and which can be with us for a long time. So I think assignments really help, though they look tedious to us during the course, but giving sufficient time to the candidate is also important with the assignments, and asking them to put on a common platform really helps. And yeah, while learning, so it's not only theory. So the ultimate aim of a postgraduate is to come out as a confident, independent doctor who can handle. So I think especially in psychiatry, we have, it is not a checklist. We go through that, okay, these are there, and so this is the diagnosis. So there is a lot of chances of shifting the diagnosis in the long term, what the patient might turn up into. So applying the knowledge, what we read up in theory, so applying it to a particular patient, constantly to individual patient is very important, especially in psychiatry. So, and especially like when we read about, for suppose, the outcome of a particular disease. So able to apply that during the practice, and that helps the candidate in practicing, like in educating the patients or the attenders of the patient. So constant applying of the knowledge to individual patients is something which we'll have to be confident at. And yeah, again, giving some time to individual candidate or during the discussion, seeing what the candidate thought process is going like, and helping them in correcting the thought process. So these are the other possible ways. So again, like we have, it is not a checklist we go through. So we have a lot of possibilities which a patient can turn into, and just being sad. So keeping bipolar in mind, for suppose. So again, it helps in framing the medication treatment plan for the patient, and explaining the outcome to the attenders is really important. So giving candidate the time and assessing on the pathway where the thought process of the candidate is also important, especially for us. So it helps us to be a better individual practitioner. And yeah, I feel by the end of 6 months or 1 year into the course, we will know about the drugs and what drug to prescribe for what patients. And everybody will learn from the individual practice or from the seniors, but able to manage adverse effects. So I think is one thing which makes a particular practitioner different or better when it comes to individual practice. So being confident in managing adverse effects is really important. And yeah, I think that is one thing we should be learning and be confident at the end of the course. And yeah, therapy. So coming to a psychiatrist is only a big thing, I feel like, with the all stigma. So people approach at least one or two other departments or other before reaching a psychiatrist. So even after reaching a psychiatrist, so it should not, the psychiatrist should not be trained only for diagnosis and pharmacological management. I think therapy is really important. So patient after coming to us in a lot of distress, so if at all when we give them option of pharmacological and non-pharmacological management, so if suppose the patient chooses a non-pharmacological management, we should be able to do some therapy, the basics of it, rather than referring him to a psychologist. So I think basics of some CBT and brief psychotherapies are really, which a psychiatry PG should be confident at the end of the course, which we should be learning through during the course, and candidates should be given enough time to learn the therapies. And yeah, in the learning process, I think the theory, we generally don't have internal assessments in the curriculum as such, like in UG. So we only have a final theory exam, so which becomes hectic at the end of the course. So the orientation will be more towards the learning about the illness, medications, management. But again, putting them during the exam for the overall, preparing for the overall exam will be little difficult if it is planned all at the end of the course. So I think from the beginning, at the end of every year, candidate should be exposed to some theoretical aspects also, so that it is useful for him at the end of the course. So constant orientation, especially to the theory, is very important, so that it helps at the end of the course. And also, again, constant feedback to the candidate is something which keeps the candidate going, is what I feel. So where we have started and how the graph has improved, or how, if at all, it is stagnant. So getting feedback from the candidate, why it is happening, or if at all it is good. So encouraging him really helps the candidate to push themselves throughout the course. And last but not the least, so we all have this thing, like in residency, it is like we'll have to sacrifice the whole personal life, and so yeah, so we'll be spending most of the time with our professional families only. So I think a candidate, some amount of emotional support, different people have different backgrounds, and especially now that it is a centralized exam and centralized counseling, so we have candidates from different states and with different languages coming and joining. So especially in the first year of residency, I think some amount of emotional support is a must to every candidate, because I've seen in my experience, my colleagues or colleagues in the other department facing problems with the language or with the place. So I think some amount of emotional support is constantly required for the candidate. So I think these are some things which have helped me, and I found it useful, and during the course of my post-graduation. Thank you. Thank you, sir. Thank you for the opportunity once again.
Thank you, Anusha, for a very systematic approach in your perspective as a postgraduate. I think there will be a lot of discussion on that. Now, we will call the last speaker of the session, Dr. Suhas Chandran. Dr. Suhas Chandran is the Assistant Professor of Psychiatry at St. John's Medical College. He is the editor of the book Perspectives on Psychiatry Training, What Every Postgraduate Should Know. And he has also written a book for all postgraduates in various departments, how postgraduates should be supported. He was very active during the COVID period also to work with IMA and other association to bring out many things for the postgraduates. And there are a lot of thoughts about how we should support postgraduates as they come to the department, and what kind of support should we give them as they take up exams and during their time, and what kind of resources should be provided to psychiatry postgraduates in general. To talk on all these topics, I hand it over to Dr. Suhas Chandran. Over to you.
Thank you, sir. Am I audible?
Yeah, you are audible, sir.
Can you see the slide, sir?
Yeah, you can put it on full screen.
Yeah, hi. Thank you, sir. Thank you for that very nice introduction. So I'm just going to dive straight into it. So I'm going to provide a list of resources that during my time of post-graduation and subsequently as a faculty, I have sort of come across to signpost our PGs with. And I mean, it might sound exhaustive, but it is by no means an exhaustive list. And I hope at the end of it, during the discussion, people can just add to the list or, comment on the quality of some of these resources as well. Yeah. So to start off with, these are basically, like I said, a list of general resources that we can sort of signpost all our PGs to. But I think one prerequisite before you hand over these resources or recommend these resources to the postgraduate, there are certain foundational variables that we need to look at. Say, for example, I'm looking at an app like UpToDate. I would want to know what is the credibility of this, who has made this, is it a psychiatrist involved, from where is it from, what are the strengths of this particular resource that I'm giving, what are the areas where this resource sort of falls short, is there a copyright that is involved, is there a fair use policy that's involved, what about cost, are there parts of this particular resource that have to be paid for, is there a part that's free that can be used, and if it costs, how much does it cost. I think I would also want to know as a faculty when to introduce this particular resource to the PG. For example, I might not give something like UpToDate to the PG in the first 1 month. Vis-a-vis comparing what are the resources that will be more suitable towards the second year of PG or to the final year of PG. So timing at which you introduce a resource becomes extremely important. I think we as faculty need to be aware of the resources that PGs anyway use, and sometimes we don't need to signpost them; they already have access to it. But we need to know what are the merits of the resources that they're using, including the bad ones, and only then I think we'll be able to give them that feedback and to know where the information they are presenting is really coming from. I think none of these resources that I'm going to be mentioning is going to be considered a substitute for a standard psychiatric textbook or any other reference. I think they are also not a substitute for learning from the patient. I personally believe that patients will still remain the best source of learning for any postgraduate. So in this list that I'm going to mention is definitely, like I said, not a panacea to all the resources that are available. And I really think that there are psychiatry departments in our country today which is comparable to some of the best in the world. And faculty from there might be available of all of these resources and more as well. But we must also be cognizant that there are institutes in the middle as well. They have different areas of strength, but they have specific lacuna too. For example, there might be several institutes who are very, very good with adult psychiatry training. But when it comes to child psychiatry, either because of a lack of resources, lack of patient load, they're not able to. Similarly, forensic, geriatric, you might have a unit which is extremely good academically in terms of clinical care as well, but there might not be a research culture or tools to sort of guide the PG in research. So can some of these resources be used by these institutes? But we also know that there are several institutes spread across the country who are struggling with PG training today. This could be because of infrastructure, because of a lack of faculty, and maybe in an overarching way in the general attempts to find the right purpose as to why they should train postgraduates. For these people, for these institutes, maybe they might use these resources much more than the human resources there. But overall, I think the takeaway is that this consolidates why such a forum like ITOPS, the Sunday specials, is really important for us to share our experiences with these resources and to sort of help each other know more such resources that are available. So I think the starter pack, like I call it, is something that we need to give as faculty during the orientation phase for the PG. I'm talking about the first few months. And one area where I've seen most faculty lack is they're not aware as to what's available in their own institute. Because most institutes have paid access to a lot of things. This could include apps like UpToDate, BMG, Elsevier, Web of Science, Science Direct, and several more. And the faculty need to make it a point to be able to be aware of this, maybe get trained in it. There are a lot of web-based tutorials available where it's easy to learn this. And this sort of helps us curate some of this to the postgraduates as well. And what we do in our particular department is we give something like a starter kit or a starter pack. It's actually a kit. It's a kit bag where we give them an institutional PG policy. Some institutes have a separate postgraduate policy, some don't. But most institutes have a departmental PG policy, which needs to be given at the outset itself so that the postgraduates know what they're in for, what the rules are, and what the regulations are, and in terms of the resources available to them locally as well. I think university curriculum has to be provided. We provide the Rajiv Gandhi curriculum for the PGs in terms of what are the standard reference textbooks, standard journal articles of specific disorders or specific phenomenology that you want to signpost them to, specific books, documentaries. We actually give them a list of movies as well, which we think would be helpful for them. We also have a separate dedicated well-being toolkit, which we provide for our PGs. And some institutes, including institutes like AIMS, Jodhpur, have a separate well-being policy itself, which is provided to the postgraduate. And I think that's important as well. And this needs to be done in the first few months. So if there's a starter pack, then could there be a finisher pack as well? I think I know of a couple of institutes where they sort of compile some of these things. So they don't provide the academic presentations that happens over the 3 years immediately. So they sort of keep collecting it. There's an academic secretary that's involved. And just 1 or 2 months before the exam, these presentations that everybody has done over the years is just given to the PG. This particular institute that I know compiles the past question papers, both from their own university and other universities, and gives it to them. We had a session where we got our postgraduates to get an interactive session with the alumnus who had just finished the exams to give them some exam tips as well. And I think the alumnus is a very, very untapped resource in most places. We don't really involve them as much as they can. And I think that's a very, very understated resource is what I feel. In many places, there is faculty feedback. This faculty feedback could be based on the exams or internal assessments or even an exam clinic. But I think the mistake that happens is that it's only told verbatim, and we assume as faculty that everything is absorbed and abstracted by the PG, but that's not often true. What we find helpful is to actually put it in writing and give it to the postgraduate so they can come back and actually sort of trace it during the exams. I think one major assumption that most faculty make is that all of these things that I mentioned, PGs will anyway have access to. They will network by themselves. They would have spoken to their seniors already or to other PGs from other institutes, and they would have had access to it. Believe me, in my time here and in other institutes, I have found that they rarely do. There is at least 30 to 50% of PGs in every batch who are completely unaware of some of these things or not aware to use it enough during the exam time. And therefore, I think that this task should be of the PG committee of the department. There are departments in the country where there is a dedicated postgraduate committee. In institutes where there, in departments on institutes where that's not there, having a designated faculty to sort of curate some of this is really helpful. So in the next set of slides, I'm just going to sort of run you through some of the various resources that are available here. So to start off with, this is TIPS. This is a training initiative for psychiatry postgraduates. I mean, it's really wonderful. I think it's been 6 to 7 years that it's been running now, and they have a huge set of a resource pool. They have a lot of exam notes that they have got faculty from different institutes to pull up, and they have a lot of PowerPoint presentations and very on topics that are usually not well discussed during most teaching programs, especially departments which have very concrete teaching programs. These sort of PPTs are extremely useful. They also started a tips bulletin, which sort of keeps the PG up to date on the recent developments in psychiatry. And it is, the authors of it are usually postgraduates themselves. So this particular group, this is the website that you can find them in. And they have a separate group on Telegram where they have a lot of case-based discussions, sharing of learning resources that happens for postgraduates. I think they have more than 1,500 postgraduates enrolled over the last 3 years. I think that's the reason they have to shift from a WhatsApp group to a Telegram group as well. They also run periodic workshops for training of postgraduates, very specifically themed things like imaging for residents and neurology for psychiatry resident, etc. And right now they brought up a tips bulletin, like I mentioned. And these are the 3 gentlemen who are behind this particular initiative. This is the other forum, which most of you might be familiar with because we are speaking in one of those forums as well, which is the Indian Teachers of Psychiatry Forum from Dr. Kishore, Dr. Vinay and colleagues. So they have a separate section called the postgraduate section. Here, there are a lot of resources, not just for the postgraduate, but for the faculty as well, including the MCI competency guidelines, some of the innovative techniques used for teaching during the COVID time, some tips for examiners as well. So this really is a very heterogeneous resource and website that is there. There's also a set of awards that sort of tailors to encouragement for postgraduate teachers as well. Now, one such resource that you will find in this particular website is a particular guidebook for psychiatry PGs. This was released in 2020. So what we did is we got faculty from different parts of the country to come together and to write different chapters on topics including clinical work, academics, research, and day-to-day challenges, like the postgraduate before me was talking about emotional challenges, things like burnout, and some basic tips, information, and strategies for some of the postgraduates. So we also got the viewpoints of the PGs as well as senior residents included in this, apart from the senior faculty. We had around 27 chapters, and currently we are preparing the 2nd edition. When we released this particular book, we released it at a particular, we didn't release per se as a conference, we just WhatsApped it to people because I think that's a major disadvantage. We really do not know how to advertise our work. And the problem with that is that the permeability of that resource like this becomes very low. Because when it is sent, I think hardly 50 or 100 people saw it. 2 months back, again, 1.5 months back, Dr. Kishore and colleagues put it up in, again, different platforms. And over the last 1.5 months, we have had more than 1,000 downloads of this book. So that just says that how poor the permeability of some of these resources are in our country. So this book basically has some of these chapters, basically the foundations of psychiatry, looking at different learning aspects, like how does the PG prepare for the grand round? How does the postgraduate involve in teaching undergraduates, those writing the DNB exam, those of consultation, liaison, psychiatry sort of involved, things with abstract skills like looking beyond the textbooks and using literature to study psychiatry, mentorship skills, and some research skills as well. These were broadly some of the contents of that particular book. So in the next set of slides, I'll just quickly take you through some video-based resources that are there. So I start with this. This is from the DY Department of Psychiatry of DY Patil. This actually won the ITOPS award a couple of years back because they actually got a set of lecturers from across the country to give video-based teaching on different topics. And if you look at it, it's a very wide range of topics that are there. I think there are more than 50 topics that are there, and it continues to build. So this is something that I think a lot of postgraduates in very resource-poor settings could actually make use of. The IPS Karnataka has a separate psychotherapy series and psychopathology series. And psychotherapy is something that most postgraduates, I think everybody will agree, even for us, the exposure to psychotherapy during our post-graduation was very minimal. So the IPS Karnataka branch has actually taken the initiative to run a primer series for postgraduates. So if you go to YouTube and just sort of give this as a search, you'll be able to find YouTube videos of some of this lectures. The NIMHANS Academy, Weekend NIMHANS, actually has a group of set of more than 50 to 60 videos on common clinical challenges facing psychiatrists and some basics like suicide risk assessments, de-addiction principles, etc., which is a very, very good resource. You can just see that by the number of subscribers that are involved in this as well. They also have a YouTube channel called the NIMHANS Indians. Now, this is basically made keeping in mind a lot of, like what I mentioned earlier, there are settings where some lacunas are there. For example, no exposure to forensic psychiatry, no exposure to child and adolescent psychiatry, or say geriatric psychiatry. So this is made keeping postgraduates and early career psychiatrists there in mind, and it sort of covers a lot of foundational principles and basics on these topics. For those of you interested in child psychiatry, this is again a very, very good resource to signpost to your PGs. This is the International Association for Child and Adolescent Psychiatry and Allied Professionals. They really got a lot of experts talk on an experiential perspective on some basics of child psychiatry. They have around 22 videos, and all of them are gold dust, I tell you, and all of them are really good for those who don't see a lot of child psychiatry cases. So in the next slide, I'm going to cover some web-based resources that are commonly used. This is StatsPearl, and I think for PGs, they find it very useful, especially in our institute where we work. It's basically from the National Library of Medicine, and it puts together basically articles in a very structured format. For example, here we are looking at something I Googled on valproate toxicity. Most of the articles are tailored this way in such, structured very well. It's almost like reading a book or reading something last minute or just before rounds, or you ask the PG to go back and read something. This is usually a very good resource and a very credible and a very standard resource for reference. Medscape psychiatry is again something that I think is good in certain aspects, in the sense that it tells you about the latest developments, what's up and coming, what are the criticisms in the field on it. And I'm somebody who personally believes that PGs need to be aware of this as well. And simply because this is what the patient is reading. And the PGs are the ones who spend the most time with patients. So I do understand this is a little bit in the periphery, but I think this is something that's really going to be helpful for them to stay attuned to what's happening around them. Psychiatric Times similarly is a very useful resource. They have a separate section called the Residents Corner. They have a lot of articles that are very reflective, very introspective, challenges that residents have had with the patients. I know this is coming, and a little bit the PGs will have to extrapolate from a Western setting, but it teaches you things that is your standard textbook can't teach you, and I think this is a good resource as well. Like, for example, this is one particular article looking at what is the dignity of the patient, and it does have a very whole array of reflective articles like this. The MD Psychiatry again is coming from the Current Opinions of Psychiatry group. They sort of publish the latest updates on psychopharmacology for PGs and the latest research initiatives and the research implications for clinical practice as well, which you can just simply subscribe to. It's a free resource, and this is something that's quite useful. They also have a separate section where they critically analyze the taxonomy and the classification of psychiatric disorders, which is something that we would encourage our postgraduates to do as well, especially when you look at transitioning like ICD-10 to ICD-11, DSM-TR, etc. I think it's a good place to find such material. This is one of my favorites. This is the Maudsley debates from the King's College of London. They basically host 3 debates every year where residents and faculty are encouraged to talk about topics from a very, very new perspective. For example, here, this is the 50th debate that happened 2 years back, where they were looking at for and against for CBT for psychos. I think very recently they had, should ECT even be a viable method for treatment? Now, I'm somebody who really believes that PG should learn some critical thinking skills. They should be able to take a take a stand on a particular topic. They should take a position, and they should also be very, very comfortable with opposing perspectives as well. Now, there are very few resources for it, and very few institutes tailor teaching towards that. So I think something like this is something that's really going to be useful for postgraduates, and I would really recommend it. It's free to download as well. This is a particular app coming from the Neuroscience Education Institute. What I would use this for is use this for case videos. I think there are a lot of interesting and complex cases in psychiatry that are presented here, and some sort of quiz-based methods that are a little bit more engaging to postgraduates than a very standard didactic. So using this in variation with other teaching methods might actually be very useful. So going on to journals and newsletters, one major lacuna that I find is in most academic presentations, in many parts, you have PGs presenting from JAMA Psychiatry, the British Journal of Psychiatry, whatever the topic is. Now, I'm not saying that these are bad journals. These are excellent journals, but these are not giving you the context in which the postgraduate is going to go pass out and start working in. So we sort of believe here that we really need PGs to look at these standard journals before every presentation or academic program that they make, and that is quintessential part of their learning process, especially if you have to practice in India. And I think these are resources that we are aware of as part of the Indian Journal of Psychiatry and the IPS. Similarly, the Indian Journal of Psychological Medicine does have specialty issues that are good. These are basically the standard reference journals in India for the other common themes as well. For research, this is a particular app that I find very useful for postgraduates, especially I think this is more towards curated towards their thesis, or if they're doing some research beyond their thesis or towards their second year. I think this is a good app for them to do. It's a free app. It basically looks at contents that are also journal-based, blogs that are on the topic, podcasts as well. You could choose where you want to do it, like in the domain of medical health sciences, social sciences, and psychology as well. And you can get more specific. For example, here I have chosen developmental neuroscience, clinical psychology, and biological psychiatry. You could choose keywords and things that you are, as a postgraduate, very, very interested in. Or if the postgraduate is doing a thesis on a particular topic, they can stay up to date on this throughout their thesis journey. And you get articles like this from time to time from the best journals. So this is something that for research, I would very much recommend. This is something we are all now aware of. In the last few years, it's made mandatory, it's made compulsory for both the faculty as well as the postgraduates as well. But there are still places where postgraduates are completely unaware of this. Swayam also offers other courses in basic research, including statistics, statistical models as well, grant writing as well, which is very, very useful. The Minds newsletter, again from the team of ITOPS, is good. It's extremely good in the way that the content is extremely simplified. So for a first year postgraduate looking at, say, a consultationalized and topic, looking to know the basics of a topic, to serve as a foundation stone, I think the Minds newsletter is extremely good. We are into our 10th year. There have been several special issues as well, and postgraduates can write to this particular newsletter. They can become authors here as well, and I think writing and teaching is one best way of learning as well. Yeah. So finally, a group of podcasts that I would recommend for postgraduates and for faculty to sort of vet before they give it is this from the MDH. It is a Psychcast. It's quite good. There are more than 80 to 100 episodes on common topics. A Psychiatry is, again, really, really interesting because it puts a faculty of psychiatry and a postgraduate in discussion about a common topic. And it sort of allows the faculty to brainstorm and to open their eyes to some of the ground challenges that the postgraduate is facing in common topics. Recently, there's one on the challenges postgraduates face in suicide risk assessment, and what are the different tools and resources they could use to overcome that. So that way, I think this is a very good resource. If you're looking at PGs to listen to something on psychotherapy, this particular podcast is really good. I think to end with, a very, very less utilized resource, and we owe a lot of this to the COVID pandemic, is conferences and CMEs. I think one very good way for PGs to learn some new topics and what's really happening around them was conferences and CMEs, and all of that had come to a stop for a couple of years. I think this is something over the next 1 to 2 years we need to start recommending PGs to attend again. And the Indian Psychiatric Society does allow for PGs now to become life ordinary members. And I think once you're part of the EIPS group, or you're part of the State Psychiatric Society group, which PGs can become now, I think it's very useful for them to find all the CMEs and the resources happening delivered to their mailbox. I think this is something that we should encourage all our PGs to do. To end with, I think we really need to sort of get feedback. It's not just about giving her resources and then stepping back and hoping the PG does it all. I think periodically we need to get feedback as to what were the strengths of each of these resources, what really worked for them in that, and what really didn't work for them. And I think this is something dynamic, this list, it will keep getting updated as time goes on. Yeah. Thank you.